Welcome everyone to the People's Health Briefing, a key component of our Trusted Voices campaign. I'm Dr. Noha Abalada from Roots Community Health, reporting for the week of March 10th, 2025. As health professionals rooted in Oakland, serving some of the most marginalized communities in California, we're here to cut through the noise and bring you the latest information on health issues relevant to us all. In today's briefing, I will provide an update on respiratory viruses, talk about the ongoing measles outbreak, as well as a recent Listeria outbreak. Starting off with the respiratory viruses, this is the percent positive of each of these different viruses each week. And remember that this only represents tests that are done in a clinical setting. It leaves out home tests or those who did not get tested during their illness. Influenza is in that bright blue line towards the top, and we can see that is coming down nicely. And we expect it to continue to do so. But even though it's heading down, we can see that it's still pretty high up there. It has a ways to go before it gets down to zero. So that means that we can still expect more cases and more illnesses before the season ends. Human metapneumovirus in the black line towards the bottom is heading up slightly, which is about what we'd expect this time of year. It tends to start later and end later than flu and RSV. And taking a look at hospitalizations, flu hospitalizations in the blue line coming down nicely after peaking around February 8th. And COVID and RSV hospitalizations, which peaked around January 4th, have been slowly trending down ever since. And so far this flu season, we've seen about 40 million flu illnesses, 520,000 flu hospitalizations, and 22,000 flu deaths, including 114 pediatric deaths. So if we have indeed reached the peak and are coming down, then of course we can still expect to see many more illnesses, hospitalizations, and deaths, because as I mentioned, we still have a ways to go. Hopefully we won't see any more bump up or peak during this flu season. Not unheard of, but we will just keep an eye out for that. And just like with COVID, people who are at higher risk of a bad outcome from the flu should be tested and treated as quickly as possible. And of course, the flu vaccine reduces the risk of hospitalization and death. So even though optimal timing of getting the flu vaccine was kind of behind us, still, if you haven't had the flu yet and you haven't had the flu vaccine, you'd still get the benefit of protection for the remainder of the season, even if you got it now. And this slide is showing deaths from the three main respiratory illnesses that are causing illness and death, and those are COVID, influenza, and RSV. Influenza's in the blue. So looking out towards the right, we can see that we are looking through February 22nd with the last couple of weeks shaded in gray. So we know those are still preliminary. Remember, we said that hospitalizations for flu peaked around February 8th, and we know that deaths lag behind hospitalizations. So we should start to see the deaths coming down soon. But for now, flu deaths have been exceeding COVID deaths for the first time since the onset of the COVID pandemic. But just a reminder that those flu deaths are expected to come down essentially to zero while COVID deaths continue. So just like that peak, that wave that you can see that's all orange this past summer, we're likely to see something like that again in the coming months as SARS-CoV-2 continues to do its thing, while flu and RSV tend to leave us alone until the next respiratory virus season, which typically begins around late September, early October. Now, taking a look at COVID deaths, the week ending February 8th, there were at least 735 deaths. And I say at least because we know that as the death certificates come in, those get added into the weeks in which they occurred. So just by way of example, last week we had reported 850 deaths for the week ending February 1st, but we can see here that has already gone up to 878 deaths. So coming down, but still quite a lot of death every single week in the United States from COVID. And since we saw that hospitalizations peaked January 4th and have been coming down since then, we would expect deaths to keep coming down until we start to see hospitalizations head back up. So we'll just keep an eye on that. So the most important things we can do to intervene here to prevent hospitalization and death are protect those who are at risk of a severe outcome like hospitalization and death by ensuring that they protect themselves. So whether that's masking in high-risk settings, also getting tested and treated as soon as any symptoms arise or as soon as we think that there may be exposure, being vigilant around that and testing, also staying up to date on vaccinations. And up to date may mean twice a year. So those with immune compromise and those 65 and up are recommended to get the COVID vaccine about every 6 months. So at least until we get a better vaccine, that is the recommendation. So trying to look ahead, first off, we know that our earliest indicator is wastewater. SARS-CoV-2 in the wastewater is considered low to moderate, and it looks to be decreasing in just about all regions with the exception of the Midwest, which is shown in yellow. And we can see that a little bit better if we just look at the 45 days. So you can see there, the yellow line is starting to tick up. So we'll keep an eye on that. In order to get a better idea about the way things might be headed, we can take a look at epidemic trends, and for that, I will share my screen. So here we're taking a look at COVID-19 epidemic trends, and we can see that it is declining in all of these darker teal states and likely declining in the lighter teal color, and in the gray, not changing. So the vast majority of the country is either not changing or likely declining as it relates to COVID-19. And remember, this is using modeling, so it's trying to tell us what might be up ahead based upon emergency department visits. And we can see that it is likely growing, though, in 3 states. And so those are in Alaska, Mississippi, and South Carolina. And if we want to look at influenza, and this really tracks with what we're kind of seeing in terms of the direction that things seem to be heading. And basically across the entire country, we're either declining or likely declining. Now for an update on measles. We finally got a health advisory from the CDC regarding the current measles outbreak. Remember, the CDC's Health Alert Network is the main way that the CDC shares information about urgent public health incidents with clinicians and with public health leaders and with public health laboratories. And these are the message types. So there's the alert, which is the highest level of importance, the advisory, which provides important information, and the updates, which is usually a follow-up on information about an incident that has already been reported. And when we had a pause from CDC communicating, we saw a definite slowdown in these health advisories. And so glad to see that finally we have one about this very serious measles outbreak. So this notice is on the expanding measles outbreak in the United States and guidance for the upcoming travel season. So this is a health advisory, so the orange. And in addition to providing guidance to clinicians and public health officials, this particular advisory is also warning potential travelers about the measles outbreak in Texas and New Mexico. So this was issued on March 7th, and it talks about the 208 confirmed cases. As of that time, we know that there have been more since then. And as usual, with this type of guidance, we see what we would expect for clinicians and public health officials around vaccine recommendations, isolation guidance, the notification and reporting process, testing management, things like that. And this is linked in the post if you are interested. But this particular alert also has a section at the end that is for travelers. So travelers that are going to areas in the United States that are experiencing outbreaks, as well as those traveling internationally. And there are links within this advisory where you can look up your destination, whether it be domestic or international, and you check your destination in order to get additional health advice. And this advice could include what I've covered here several times about potentially vaccinating a child early. So if you're traveling with a child that is between 6 months and 11 months of age, they may need to get that extra early dose of MMR vaccine so that they can be protected, because otherwise we typically don't vaccinate until 1 year and up. And the alert also suggests that after traveling to an area with an ongoing outbreak or after traveling internationally, to a place that has a measles advisory. Watch for symptoms of measles for 3 weeks after returning. Now, if you've been vaccinated with 2 doses, you really should be pretty well protected. But we know there are a few percent of people who, for whatever reason, don't mount a good response. So still a good thing to be aware of. And I am certainly glad to see that there is a health advisory, as we were definitely concerned with that slowdown in communications, and we wondered whether another one would be forthcoming. So didn't seem quite as timely as I perhaps would have expected, but glad to see it ultimately being issued. And as I mentioned, this health advisory referred to 208 cases, so 198 in Texas, 10 in New Mexico. And this sadly includes 1 child death in Texas, 1 adult death in New Mexico connected with, shot up to 30 from 10. So there's an increase there. And unfortunately, the Texas Health and Human Services Department has not updated their measles page since March 7th. So we don't have an updated number there, but we do expect there to be continued cases. Unfortunately, this outbreak does have some legs to it, still seems to have some momentum going. So we will continue to keep an eye on it. And in related other disturbing news, there have been reports of several cities in Texas that are actually running out of the MMR vaccine. So this really, it really could be a devastating situation, first off, because we now have people who are unvaccinated and undervaccinated who are fearful and would like to be vaccinated. But then we also have people who have been exposed. And remember, as I covered in some detail last week, the measles vaccine is something that we can give as post-exposure prophylaxis within 72 hours of exposure in the hopes that will improve the clinical course. No guarantee, but it is something that can improve the clinical course. So it is potentially going to be recommended. So if we have a shortage, that's a real travesty. So on the one hand, it's good to hear that there's an increased demand for the MMR vaccine, but it is certainly concerning that some places are running out and some are having to limit giving the MMR vaccine to those who are at greatest risk, which is also just tragic because this is basically recommended for everyone who is due or who needs it. So this is beyond pitiful. It's actually just disturbing. It's truly disturbing in a country this wealthy with this many resources and so much knowledge and information, that what we should be seeing are massive education campaigns, massive vaccination drives with plenty of supplies to vaccinate everyone who needs and wants it. We should be seeing a concerted effort to intervene, to stop this outbreak, and to save lives. And instead, we seem to be having a vacuum in terms of leadership. It's the nicest way I can say it, because we are seeing disinformation, we are seeing alternative facts, a spouting of bizarre ideas about remedies that don't work. And the bottom line is what I can only interpret as an absolute indifference about what is preventable suffering and preventable loss of life. It's one thing if we don't have the information or the knowledge, but it is quite another when we choose willful ignorance. So far in 2025, there have been other cases in other states. In fact, there have been cases in 12 states so far, but it does appear that in the other 10 states besides Texas and New Mexico, it's mostly been isolated imported cases. So the outbreak situation itself is very troubling and very significant, because this is not just about imported cases, maybe spreading it within a household or something like that. This is about sustained transmission within the community. And if transmission is sustained over a period of time, that can basically signify measles becoming endemic again in the United States. So if this continues, we are at risk of losing our elimination status of measles. We are at risk of going back to endemic measles in the United States. really just basically going backwards. So the good thing is that many places in the United States still do have high enough vaccination rates to give us community immunity. But sadly, there are an increasing number of vaccine exemptions. There are more pockets of under vaccination and dropping below that threshold that we need to have community immunity, and this would make those communities vulnerable. We know that babies under 1 are generally too young to be vaccinated. They're going to be vulnerable. Those who are immunocompromised, those who are unable to be vaccinated, those who do not mount a good response to the vaccine for whatever reason, all of these people are placed at increased risk if they are in an area of an ongoing outbreak, or really if they're exposed to measles at all. So this really is a situation where if we don't step in and do what's needed to change course, we could find ourselves backsliding to a place that most of us really haven't seen in our lifetimes. And that is truly shameful after what we have gone through with the COVID pandemic. Instead of learning and improving, we are choosing to go backwards. And the United States really has enjoyed being at the forefront of research and scientific discovery and scientific innovation for a very, very long time. So perhaps we're deciding we don't care about that anymore. We're ready for another country to take the lead. It's just really not clear to me what the end game is here. But between discouraging the very things that we know have improved our quality of life, such as vaccination, and canceling our participation in global health efforts and ending support for critical research, it seems that maybe somewhere a decision is being made to demote ourselves in this regard. So according to the CDC measles page, which I've linked in the post, so far we've had 222 confirmed measles cases in the US across 12 states in 2025. And it's significant that 93% of these cases are outbreak associated. So if we compare this with all of 2024, there were 285 cases and 69% of those were outbreak associated. So even though last year was definitely an increase from the year before, it was more typical in that more of the cases were sporadic. They were mostly imported and then caused smaller outbreaks, but really didn't quite take hold in the same way that we're seeing here with the current Texas and now New Mexico outbreak. So we're just barely beginning March and already getting close to the number that we had the entire year last year. And we have not only a significant outbreak, but we have also not just 1, but 2 deaths. And these are the first measles deaths in the United States in about a decade. So moving backwards. And so just to recap, measles is the most contagious infection known to humans. One person can spread it to many susceptible people in a very short period of time, and even can leave it behind even after they leave the room. Infectious particles can be there for hours. And if you don't have prior protection and you come near or even behind someone who's contagious, you have about a 90% chance of getting infected with measles. And in addition to pneumonia and encephalitis, hospitalization, all these things I went over last week in some detail, including a very severe later potential effect that can happen as well. But also it is known to wipe out some of our immune system. So it can cause kind of amnesia in some of our immune system, making people susceptible to then subsequent infections. So if you suspect measles, please contact the public health department or your physician immediately. And now I'm going to shift gears and talk about listeriosis, because we've been seeing increasing reports of listeria outbreaks and even deaths, something that we don't hear about all that often in the United States. In fact, listeria is actually kind of rare in the US, yet this year and last year, we've seen many outbreaks associated with everything from deli meat to donuts to broccoli and frozen shakes. And we've had a particularly serious outbreak in the past few weeks that I wanted to talk about today. So Listeria is a bacteria that can contaminate food, and those who consume the contaminated food can become sick. When you get infected with Listeria and get sick, your infection is called listeriosis. And Listeria can cause 2 different types of illness. One is an intestinal illness, and the other is more severe, is invasive illness. So intestinal illness usually just manifests with vomiting and diarrhea. Usually it resolves on its own. Most of the time, people don't even get tested for it, so they don't know that they had it. But in a subset of people, it can progress on to invasive listeriosis, and this is the one that we are generally more concerned about. So interestingly enough, invasive illness manifests very differently in people who are pregnant. So in people who are pregnant, they can actually have pretty mild symptoms, even with invasive listeriosis. They can have mild symptoms or even no symptoms at all, but there's a very high rate of miscarriage, of stillbirth, of premature birth, or of a life-threatening infection in the newborn. So really, for pregnant people, the invasive listeriosis is primarily fatal to the fetus or the newborn. In non-pregnant people, especially those who are older, 65 and up, or have immune compromise, if they progress on to invasive listeriosis, it can be quite serious. So the symptoms can be headache, stiff neck, losing balance, having seizures, becoming confused, fevers, muscle aches. It often results in hospitalization, and there is a significant mortality rate. About 1 in 6 people with invasive listeriosis, non-pregnant people who get invasive listeriosis, will die. Symptoms usually start within about 2 weeks after eating the contaminated food, but really it's a big range. It could be as soon as the same day or as long as a couple months afterwards. So bottom line is we are most concerned with pregnant people, newborns, those 65 and up, and those with weakened immune systems. And this is what made this most recent outbreak especially tragic, because unfortunately, what was contaminated in this situation were supplement shakes that were primarily distributed to long-term care facilities, which is where vulnerable people reside. So there was a recall just a few weeks ago, February 22nd, on these frozen supplement shakes. I've linked to the outbreak information in the post. So far, there have been 38 cases. 37 of those 38 have been hospitalized, 12 have died, and this is across 21 states. So this was a situation where these contaminated products sadly were specifically distributed to some of the people who would be the most vulnerable, and the result has been quite deadly. So there's not a whole lot the average person needs to do about this, because almost any type of food could become contaminated, and it will be difficult to know what it was unless you have the recall notices. So in general, it's just the things we know about safe handling of food, keeping your surfaces clean, washing your fruits and vegetables, cooking your foods thoroughly, and so on. But there are very specific guidelines when it comes to pregnancy. And that is because about 1 in 4 pregnant women who get listeriosis will lose their baby. So this is very significant, and it is the reason why there are so many things that pregnant people are asked to avoid eating during the pregnancy. So I put a link to those recommendations in the post. So if you or someone you care about is pregnant, these are good things to know about. It mainly has to do with avoiding unheated deli meats, unheated soft cheeses, unpasteurized milk products, pre-made deli salads. Pretty much just walk right past that deli counter altogether if you're pregnant. Refrigerated smoked fish, and even melons that have been cut and left out for more than a couple of hours. So really you should only eat freshly cut melon. There is even an ongoing CDC investigation right now into an outbreak related to Listeria in enoki mushrooms. So these also should not be eaten raw if you're pregnant. So several things to sacrifice during pregnancy, but once again, with 1 in 4 babies being lost due to Listeria infections, even though mom may feel relatively fine, this is just something to be aware of and do our best to avoid. It's important to note that spread from a pregnant person to the fetus is the only instance of person-to-person spread of Listeria. So other than that, this is not something that can transmit from human to human. So one thing that I believe we've been able to count on up until now is monitoring of the safety of our food, and a response when something is noticed, like inspecting facilities and trying to identify the source and tracing it back and putting out proper warnings. So along the lines of what I was mentioning earlier about us seemingly going backwards in matters related to health and public health, as well as just deregulating industries in several ways, I'm definitely watching this and hoping that this is not going to be the case as it relates to our food safety, but this remains to be seen. So let's just continue to stay informed. Let's continue to do what we can to keep ourselves and our loved ones safe and healthy. Let's implement all the best practices as it relates to our food consumption, as it relates to preventing the spread of respiratory illnesses. If you don't have a primary care provider, please get one and develop a relationship with them and make sure you're getting the appropriate screenings, vaccines, and tests based on your age and risk factors. And remember, if you don't feel well, make sure that if you're someone who should be treated for respiratory illnesses like flu and COVID, and if you have those symptoms, please get tested to see if you have them so we can get you started right away on those antivirals. The sooner the better. It can be the difference between a limited course and hospitalization or even worse. And if you don't feel well, also remember to get your rest. Don't push yourself, please. And remember, eat a balanced diet, quit smoking, limit your alcohol intake, avoid sugars and processed foods and artificial ingredients. Make sure to get some regular physical activity, get some fresh air, manage those stress levels, and get a good night's sleep. This concludes today's People's Health Briefing. Thank you so much for joining us, and we'll see you again next Tuesday at 10 a.m.